Hi, I'm Carol.
And I'm Mary.
Let's talk about pets. So today in our show, we're going to discuss vaccinations. These are the most common recommendations for vaccinations. Your veterinarian is going to be the best source for specifics. We'll start off with the felines. Rabies, most pets actually, it's required that they have rabies. Most states require this by law. It's usually given at 16 weeks of age and then boosted yearly.
The next in the core set of vaccines for cats is the FERCP, also known as feline distemper or feline upper respiratory. FERCP stands for feline viral rhinotracheitis, calicivirus, and panleukopenia. This vaccine is generally started between 6 and 8 weeks old and then given every 3 to 4 weeks until they are 16 weeks old. Once they become an adult cat, it is doctor discretion and lifestyle on whether this vaccine is given yearly or every 3 years.
The next vaccination considered to be part of the core is feline leukemia. It's usually given after a negative feline leukemia or FIV test. It's given at 12 weeks, then boosted 3 to 4 weeks later, and then after that yearly. Now this one is typically considered optional for our older cats if they're indoor only with no exposure to outdoor kitties or unvaccinated kitties like little Fosters or something like that.
Now, those are the only 3 for cats, so this is on to dogs now. Dogs are also recommended to get a rabies vaccine. This is, again, usually required by state law. Generally starts between 12 and 16 weeks old, and then at a year old, it can, depending upon the state and county regulations, be either a yearly or a every 3-year vaccine. This will be known by your veterinarian what the requirements for where you live is.
The next one is Distemper parvo, DHPP or DA2PP. It is the distemper, hepatitis, adenovirus, parainfluenza, and parvovirus. Don't worry, it's all one vaccine. It's generally started at 6 to 8 weeks, then boosted every 3 to 4 weeks until they're 16 weeks old. And then doctor discretion either goes to a yearly or every 3 years, as they recommend.
Next on our list of dog vaccines is Bordetella or kennel cough vaccine. This can be started as young as 6 weeks old, and then there are 3 different versions of it. There is an intranasal and an injectable, which is underneath the skin, and then an oral version. Whichever version your veterinarian carries, and also the lifestyle of your animal, whether they do frequent boarding visits or go to groomers a lot, the vaccine itself will need to be boosted every 6 months to a year depending on those variables.
The next vaccine is Leptospirosis, also known as just Lepto. This one is considered kind of a regional vaccine. For us and here in Austin, it's a core vaccine. It's very important. It's a bacteria that's transmitted by wildlife in their urine. It can live in standing water, and it doesn't even have to be a big body of water. It can be a small puddle of water in your backyard or even on a leaf. It's zoonotic, which means we can get it, and it can cause liver and kidney failure in us and our pets. It's given at 12 weeks, boosted every 3 to 4 weeks, and then given yearly.
One little side note, sometimes it will be combined in with the distemper parvo vaccine, so it won't necessarily be considered separate. This, again, will depend upon your veterinarian and what vaccines they carry.
Yep.
Next on our list is the Lyme vaccine, which I am going to say right now, I know very little to nothing about it. Austin, Texas does not have an issue with Lyme disease down here. I know that the East Coast and sections of the Midwest do. If you live in the area or if you know that Lyme disease is an issue in your area, please consult your veterinarian about whether this is a vaccine that they recommend. Down here in Texas, we really just kind of make sure people stick to using flea and tick prevention, and works for us.
Yep. Next one we have is the influenza vaccine. This one is also considered to be a lifestyle vaccine, usually is only required by boarding, grooming, or show facilities. Can be given as early as 6 to 8 weeks, boosted in 3 to 4 weeks, and then given yearly.
All right, and the final one on our list of vaccines for dogs is the Rattlesnake. This is also a lifestyle vaccine. If you have a dog that you take out hunting, if you have a dog that likes to go to parks with you, if you live in a city but the parks also are known to have venomous snakes, then it is probably a good idea to at least try this vaccine. It is usually started at 16 weeks, given initially at 16 weeks old, and then boosted in 4 to 6 weeks after that. Then again, depending upon the frequency of possible interaction that your dog could have with venomous snakes, every 6 months to a year it gets boosted after that. With the rattlesnake vaccine, though, the key thing to know is that it is not going to protect your animal from a venomous bite by itself. What it does is it hopefully decreases the severity of the bite, and it also gives you a little bit of time, maybe like an hour or two, in addition to get to a veterinary clinic. So like if you are 2 hours away, this would give you a 4-hour window, but it is not at all instead of taking your animal to a veterinarian. If your animal gets bit by a venomous snake, take it to a veterinarian immediately so it can start its anti-venom injections, or treatment, I should say.
Pigs and goats, some people like keeping these as pets. If you are going to get one of these guys as a pet, do find a veterinarian near you that has the ability to treat these animals. A lot of our, veterinary clinics in our area are just cats and dogs.
And even there are a lot of exotic clinics that don't see hoofed animals, which cover pigs and goats. I work at an exotics clinic currently. We have 5 doctors and only one of them will see pigs. So there are vaccines for pigs and goats, but you do need to kind of search for the place that will see them. Along with that, another animal in an exotics clinic that you would see frequently is a ferret. Ferrets do need vaccines. They need a rabies vaccine and a distemper vaccine. Veterinary clinics will typically use the dog versions of this, and that is perfectly fine for their ferrets. These are life-threatening diseases in them, so it is best to get them vaccinated for it also.
And no matter where you acquire your new pet, please consult with a veterinarian soon after to establish a relationship. This will help when you discuss things like vaccines, diet, lifestyle, and their basic health care. This will also be relative to your exotics, your reptiles, birds, fish, etc., to help discuss their basic needs.
All right, thank you for watching our video today. If you liked our video, please click like below, and please subscribe for future videos.
Thanks.
Have a great
day.